and it'll take a minute for everybody to come in. Hey, good evening, everybody. We're trying to get one more presenter on, and we'll get started in a minute. And apologies for the link. I sent out the right link. I don't know what happens with Zoom sometimes, so we will get started in just a minute. We've got a lot to go over tonight, and I'm looking for one more presenter. There he is. So, okay. There he is. Hey, David. Sorry about that. We're going to get going. We're going to start with David, and he'll talk about several things, and then before we go to the next person, we'll open it up for questions. So put them in the chat. And welcome. Thank you all for being here. This is your slide for the occupational therapist, David.
Yep. Thanks. I'm sorry, just getting on board with you guys. Okay, I just wanted to include in our town hall update that there is pending legislation from the occupational therapists, and they've put forth a bill to include dry needling in their statute. The bill largely mirrors what we saw with physical therapists and athletic trainers to some degree. We also recognize that chiropractors included dry needling in the statute last year, and medical doctors, obviously, and nurse practitioners, to the extent they want to, can use dry needling. So occupational therapists are just sort of the natural next profession to want to incorporate dry needling in their statute. It was a bill that was supported by the president of the Senate. It was a bill that was personal to him, and that it was well understood in the Senate that it was a priority. And of course, it had no natural enemy from the Florida Medical Association, the Chiropractic Association, PTs, nurses. Everybody sort of stood down in this example. And, without opposition to a bill like that, we have to follow the legislative mood in the last, I'd say since 2020, when they approved dry needling for physical therapists, has been pretty much to allow, especially practitioners that have autonomy, to include dry needling in their statute. So no amount of opposition is necessarily going to stop that. And so we just want to make everybody aware of it. If you see that, I think it was passed in the Senate already, and I think there's just a couple of steps in the House before it's voted on in the full floor. So just as a matter of full disclosure, just letting you guys understand and know that this has happened and why this has happened, and why we have the position that we have on that. Next slide. Actually, if you want to go back to the first slide just for a quick second. Okay, I just wanted to end that by saying, recommendation at this point is that the legislative committee focuses on strengthening and clarifying the Florida acupuncture statute. We have enough issues with Chapter 457 that really need some correction, that staying proactive and working on, elements of our own Practice Act is a much better, look, and a much better, from a practical standpoint, position for us to be in, advocating for what we can do and less consternation about what other people are trying to do. And so our goal here at the legislative committee, as well as FSOMA as a whole, I hope, is that we want to make sure that the licensed profession of acupuncturists are able to practice at the top of their training and at the top of their scope. And we still, work very hard every day to make sure that that's a reality. But the challenges that we have are many, and so all we can do is keep trying to address those things one by one. Thank you, Ellen. Next slide. I also wanted to give you an update on House Bill 169, which is the bill that we introduced to update the Florida acupuncture statute. And, Rep. Alvarez is our legislative champion and sponsor again this year. And he was able to put forth the bill. And right now it's heading on its way to the Rules Committee. So he's done a good job of bringing that forward. And the focus of our bill is to include a definition for what is the practice of acupuncture. And we think it's important at this time that we include that practice of acupuncture also states that we have evaluation and management responsibilities and privileges for our patients, meaning that we can bill for evaluation and management time as well as our procedural times. It includes the language for acupoint injection therapy, AIT, it also includes a mini formulary for products that are allowed under AIT injection. And so right now we don't have security of AIT within the statute because it's not mentioned. It's referenced indirectly through adjunctive therapies, but certainly our prescribing rights needs to be enhanced in order to make that concept, fully clear and available in the scope of practice, and also make it so that other professions like pharmacy can look into our statute and recognize that we have access to a mini formulary and that we do have prescribing rights for those products.
This will help fix the problem with pharmacies not selling to us.
It's a big step toward that, because right now pharmacy is regulated just like we are. They have a responsibility to make sure that they're not selling restricted drug products to individuals that aren't licensed to use and dispense those. And so although it's referenced in rule, it's not established in statute. And there's why we've had an ongoing running battle with getting access to even simple things like vitamin B12. And so we're looking to clear that up. And it makes it more clear for the profession, obviously, but equally important, it's more clear for other professions that are regulated that need to see that we have authority to do those things. And the way to do that is to update the statute. We're also including a definition for direct supervision. And again, the purpose of direct supervision is to allow acupuncturists to supervise and bill for other services that might be included in our scope of practice that another licensed practitioner is performing, like massage therapy or manual therapy in the office. As it stands now, we can only provide for and bill for services that are provided at our own hand. And as a bit of a force multiplier in our offices, it's helpful to have direct supervision privileges. This way, we can have extenders that are working in our office that are working within their scope and within an area that we could supervise, so that we can, like I say, not only supervise, but bill for those services if that's something that you wish to do. We also expanded the CEU categories to include practice management CEUs. And ideally, we want to do this because there's lots of areas of practice management that are now excluded for CEU credit. And the nature of our practices have changed substantially since 2001 or 1999 when it was last updated. And so we want to make sure that you have access to better understanding about maybe how to use digital products in your office, like an EHR, ER, things related to cybersecurity, as well as just practice management models that make life better for you as a practitioner, but also enhance your patient's experience in your office, whether that's scheduling processes or care options. We would like to see a little bit more access to practice management strategies and tools as part of a learning module. And there are a couple of other technical things that we did to include, for example, CEU providers that are licensed out of state, can provide hands-on acupuncture training within Florida directly. and things like this. Just a small exemption for something like that's been a little bit of a sticky situation over the years, and it's time that we're able to sort of solve that. And so, like I say, we want to thank Rep. Alvarez, and hopefully we'll have an opportunity to see him again in August at the conference and thank him in person. But the bill in the House is going to move to the floor for a full vote, but it's stalled in the Senate. Again, we did not get a hearing. And the challenge is not just ours alone. I just take a second on this and say there's a little bit of leadership challenges within the Senate, and professions that would otherwise have a bill like ours that had no opposition, friendly language, had come to an agreement with the chiropractors and the FMA and other people who wanted to have input on that. Years ago, we've had settled language, but chiropractors didn't get their bill heard this year. Optometry got their bill shot down this year without a hearing, and acupuncturists included in that. So very little moved in the Senate that was related to a practice-related legislation. There's going to be a change at the leadership in the Senate, and there's also going to be probably a change in the Health Policy Committee chairperson leadership, and that the person who's currently in that role will probably have another distinction of chairmanship, but in another committee.
Got some questions for you, David.
Yep.
Acupuncture Today recently posted a 6-part white paper that mentioned dry needling and how the author thought we should approach it. Wondering if anybody has read it.
I'm sorry. I missed the middle part of your statement.
Acupuncture Today posted a 6-part white paper that mentioned dry needling and how the author thought we should approach it.
I think there's ideas to work on, incorporating dry needling into our training and practice, and maybe adopting some of that language. To me, I think, as somebody who's been very close to this for a long, long time, there are some advantages, and then there are some things that are challenges to us doing that. From our perspective, dry needling is acupuncture, and the minute we start, providing, separate terminology, separate training, additional training, certificate programs, well, then maybe we're saying that maybe it's not, acupuncture. If it's acupuncture, why do we need to extend our training and certification into this area of specialty? I don't have a position on that one way or the other. I think people smarter than me are working, collectively across the nation to come up with a solution to make sure that if dry needling continues to move forward, that acupuncturists are included as qualified practitioners of dry needling. That's sort of the important thing. I guess the last thing I would say in terms of opposition is just to understand, in 1989, Maryland was the first state through board rule to bring dry needling into the scope of practice for physical therapy. That was in 1989. Many, many, many states between 1989 and 2020 have wrestled with the dry needling question, primarily with physical therapists, but also chiropractors and now other types of practitioners. I think Florida and AFSOMA can be very proud of, our record and distinction for making, educating the legislature about what we consider the dangers of poorly trained people performing acupuncture procedures, no matter what they chose to call it. And, I think Florida was maybe the 38th or 39th state that finally adopted language through the legislature to allow another profession to perform acupuncture services in Florida. And so we can feel, that, we put up a robust effort to make sure that we continually educated other, legislators and regulators about our concerns about that. But ultimately, it's not it's not within our purview to say what other people cannot do. If they make a successful argument as to why their training is adequate and they have safety elements in mind, they're insured to protect patients, whether or not we're concerned about it, and we have lots of reasons to be concerned about it. It's just that it's not a winning argument when, if you go to the legislature and you say, we don't think that occupational therapists can safely perform dry needling. One, there's no data to support that. Two, if it's safe for medical doctors, nurse practitioners, chiropractors, physical therapists, athletic trainers to do it, why can't occupational therapists? Instead we just look like we're obstructing the, free enterprise of another practice, which is, something that we want to avoid doing. It's not a good look. Two, it can be perceived as illegal meddling in that way as an antitrust matter. And we've seen that happen in other states. So there is a little bit of a fine line to walk when it comes to navigating these questions. And sometimes, we've got our own challenges in terms of strengthening, clarifying our own Practice Act. And my energies have been focused on doing that for the last 5 years. Like I say, after, putting a lot of effort into making sure that we, provided adequate guardrails as best we could for Floridians who access to dry needling with physical therapists, we have a lot to be proud of. There are other states that have, less requirements for training, less guardrails, less supervision, less tracking of injuries and things like this. Florida does all of that because we lobbied very hard to make sure that, protections were in place for the public. Okay. Any other questions for me, Ellen?
I'm asking somebody to email you about a declaratory statement because hopefully we're taking care of the AIT issues, but it's not a question exactly. It was a statement.
Okay. I'll look for it. I'll see it. I'll respond directly.
Okay. And any other questions for David while I'm looking at the chat? Okay.
Thanks, everybody.
We're gonna let PASOMA President Rebecca Acosta talk for just a minute about some possible trends in the doctor title. And we aren't, it is a question for you, David. Are we putting any changes to titling into law with
Absolutely
our statute? Not. Okay.
Yeah.
Okay. Part of that was 2 years ago when that whole thing happened with acupuncture physician. The FMA was like the bruiser in the room. There's no way to make anything in statute, but fortunately that issue went away for now.
Right. I think, just to piggyback on what Ellen's saying is there was an effort and, a relatively successful, but it had the comfort language was found in an FMA bill that was basically providing guardrails for certain physician-related titles, and they largely related specifically to things like areas of specialty in medicine. So, in other words, an anesthesiologist, gastroenterologist, urologist, and you go through all of the areas of specialty. Is that they wanted them codified in statute, and that that only somebody who was licensed and educated in that way could use those titles. And then the issue kind of bled over into some other non-physician groups like chiropractors and acupuncturists and other people in terms of, what we could and couldn't do. But the question of in Florida is unchanged. The passage of that law didn't affect how acupuncturists can legally advertise here in Florida. And so what I would say is that, there was a lot to be said and there was a lot of energy around that question. But the most damaging parts of what was originally included in that bill that affected our profession was removed. And so the bill moved forward and it satisfied what medicine was trying to do, was protect certain titles that were exclusive to medicine. And it was largely born of a fight that they were having with a couple of areas of specialty that came out of nursing, like nurse anesthetists in particular, who were using credentials that maybe looked too closely to an anesthesiologist. And they were really trying to lay down the law in terms of what people could do and what they couldn't do. But for acupuncturists' perspective, we have the same set of, professional titles through our licensure, which is a licensed acupuncturist. If you look at your license from the Department of Health, that's what it says on it. And then there's titles that are provided through the advertising rule from the Board of Acupuncture. Okay, and those are really the only four things that I can think of, or two categories. One, what's on your license as a licensed acupuncturist, and two, it's afforded directly in rule. Go ahead, Rebecca. I'm sorry took your time.
No, thank you. Thank you, David, for sharing all that and giving us good clarification on that. So yeah, thank you everybody for joining us tonight. I just want to bring awareness of an experience that happened to me recently, like a week ago. And it was really bizarre. And I'll just say this, that I'm glad it happened to me and none of you out there. So I'm waiting to see what comes of this. But I was at a health fair at a local YMCA. The health fair was a dud. But anyway, I had a guy like 10 minutes before the whole event ended, and he came to my table, and I wasn't even really talking about acupuncture. There was supposed to be another acupuncturist at that fair, so I was taking over the nutrition portion of it. Um, anyway, this gentleman, we're just having small talk conversation, do it all the time, nothing stood out. And I had an old flyer that I had used maybe up to 10 years ago that had, the name of what I do. And then I must have forgotten to take doctor off of it, DR, Rebecca Acosta, AP. And he pointed out to me the DR part. And he said, "Are you a medical doctor?" And I honestly said, "No, I'm not. I'm the AP stands for acupuncture physician." And we talked a little more, and he grabbed my papers and he folded them up and he walked away, but he was pointing his finger with my papers and walking away at me. And he says, "I think this is confusing. I think it's misleading, and I think it's illegal. And I think you should be reported." And I was just shocked. I'm not a quick on my feet person, but I was honest with him, and I fully expect to have something come of it. I anticipate that, so I'm waiting. But I'm glad it happened now and that we could address it at this town hall, because I think we all should aware. I think, and correct me if this is not right, but I think FASOMA's stance on this is that it's legally risky to use that DR in front of our names, and do it at your own risk. I thought I had
Unless you have a DACM or a doctoral
unless you
level
have the
degree.
doctoral,
Yeah.
right? And I do
Yeah.
not, but we were taught in school. Galina, you and I were in school together, classes apart, but we were told specifically and clearly that we could call ourselves this. And I thought I went through my website and erased anything that might be risky. But, when you're looking at something over and over and over again, it just kind of blends into the background, and it didn't stand out to me and I missed it. So I am right now in the process of going through all my forms, all my anything public facing website, all my handouts, everything, all my literature, my business cards, my flyers. And I shall be, I'm in the process of removing that. And I would just like to encourage you all to really take some considerable inventory. It was such a bizarre, weird interaction that it was, I'm not a conspiracy theorist, but I'm like, golly, are we being targeted, or what the heck is going on? So I just wanted to say that. And yes, a lot of us were told we could say this, but I think we need to be highly cautious.
Yeah. There's also, I'm sorry, there's another case that's not public yet, so we can't share details, but of someone who's being taken to task for having doctor on the website, in spite of having clear indication of their training, in spite of having AP behind their name. So the the Board of Acupuncture meeting, this was probably 6 years ago, I attended, where the lawyer was asked about it. They said people with a doctorate could use the title doctor. But they didn't say, "Oh, you can't if you're not a doctor," but they didn't feel like they had to, I think. So,
Yeah.
the position of FASOMA has always been that it's risky, legally risky. You could get as many lawyers, people saying as many things as there are lawyers, until there's some sort of court case, and then it's that would solidify it. But yeah. So,
Yeah, and just I'm reading comments too on this. If I can share at Ronald, yeah, you're absolutely right. I graduated in 2010. They didn't have a doctoral program then, and the wording and the guidance from a lot of our teachers. I mean, even as recently as maybe 5 or 6 years ago, the schools in their white coat ceremonies had the DR printed on them. So, this is this is probably prior to 4 or 5 years ago, definitely.
yeah. But even if it's not like the Department of Health going after people, it could be a profession has decided to take it upon themselves if they notice something. So, it's hard to know, but having two things happen.
And
Yes,
someone's
you can use DOM and AP. DOM is not defined. It could be diplomat of Oriental medicine. So, just using DOM doesn't mean doctor necessarily. The degree is what confers that title. So, David, do you have any, or Galina, any thoughts on this?
No, I think, Rebecca's explained it perfectly. And I think that the challenge is now for our profession has been sort of split on the question for a long time because for the last, say, 15 years, now that we have an emerging doctoral program nationwide and, here in Florida, and now we see several versions of that, whether it's a first professional doctorate or an advanced degree, is that now we have this sort of bifurcation of the training, and we need to be more mindful of how we use that. If you have a master's and that's your terminal degree, you're a licensed acupuncturist. If the board of acupuncture provides additional language that you can use in the advertising rule, and you're using it appropriately, it's likely that you probably wouldn't have a disciplinary case. But if you're going to use doctor, whether it's DR or spelled out DOCTOR, the concern is that the standard for a disciplinary case, if you look at the statute, is that it may be false, misleading, or fraudulent, right? And so the idea is the burden is on the practitioner. It's our job to vet that language in a way to say, to ask ourselves, is it false? Maybe. Is it misleading? Likely. And actually it's not fraudulent because they took the fraud statute and made some changes to it here in Florida. The criminal fraud statute doesn't read the same way it did in 2012. But certainly this question of being false or misleading sets us up for, under prohibited acts for, reasons for disciplinary action under 457-109. There's a handful of them there. And so all I'm saying is Rebecca said it perfectly, but I would say the burden is on us individually to sort of look at how anything is forward facing in our practice. And if it's false, certainly we don't want to be doing that. But even if can be construed as misleading, and you don't want to be too torturous in your explanation of why something is not misleading. It's meant to, you have a convoluted answer why it's not misleading. That's probably not going to help your case. It has to be simply not misleading on the face of it. And you want to think of your patients, everybody from, social media aware young person all the way to an elderly retired person, and make sure that anything that's forward facing in our practice, fairly represents who we are and what we do. Thanks, Rebecca. Thank you for having courage to share your scenario, because I think there are many, 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 many licensees who have a terminal degree as a master's who use some version of doctor in their titling. And I think there's going to be a decision that's going to come down from the Board of Acupuncture, most likely on this, probably in the next 12 to 14 months. And so the time to get this right in your own practice is now.
So let me add 5 cents to all that. As an insurance committee chair, I had researched that question very, very thoroughly. It also depends where you use your titling. From the standpoint of credentialing, like if you are credentialing working in the hospital, if you are credentialing with insurance company, you are credentialed as a licensed acupuncturist, exactly how your license says. So on all that official documentation, like your SOAP notes and everything else, there shall be a licensed acupuncturist credentials. because that's what CMS specifically specifies on the SOAP note, name and credentials.
Okay, thank you.
Yeah, thanks.
All right.
That's helpful. I'm taking notes.
Alrighty, so let me do a little bit call for action. Hopefully you all know that Florida law statute 456.44 mandates that practitioners, and it's meant MDs, DOs, and anybody else who has direct access to patient, discuss and document non-opioid alternatives for pain management, including acupuncture. So, FASOMA has initiative. We are planning a direct email to MDs, DOs. Next step might be PA's marketing campaign to solicit referrals to acupuncturists. Since all what I hear from MDs, first of all, will insurance pay for acupuncture and where I send my patient to? So we will provide for MDs referral guidelines. We will provide for them some information on insurance reimbursement, and we will include, obviously, the FASOMA webpage, Find the Practitioner and About Acupuncture on these marketing materials. However, we need your help. It's just very few of us volunteers. We are not always masters of marketing or simply time short, and it has been a long overdue project. So please, 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 if you are passionate about our profession, if you have at least some writing interest to help us to create email verbiage, contact Ellen at director@thefasoma.org, and we for sure will appreciate your help. Next slide, please. So, continue on that conversation. We really want to make that campaign meaningful because everything costs money, and all of this is fairly expensive. We do need to track the return on investment since we all run a business. We will be sending an email asking you to update your member profile on the FASOMA Find the Practitioner website to include the area specialized in the insurance plans you accept. That will be just a check mark in a few boxes. Nothing extraordinary, nothing extra difficult. But again, just because this is a first question which patients and physicians ask, will you take my insurance? Also, we do need, after then all that campaign goes, we will need to track the results of that. Please include in your initial intake form the following question. How did you find about us? Google search, friends, family, and MDDO referral especially. And ask patient to include MD name and contact info. Because that those MDs who are free sources of advertisement, we really want to address them. So that is on your side. And we will be sending questionnaires, checking up how successful our campaign was. That probably, an year-long campaign, it will take some time, but we're working on that. Next slide, please.
I want to make a point here. We've started on a portion of our program where we're talking about actions to take as a profession to promote ourselves, to promote our medicine. Because, yeah, we do acupuncture and sometimes it looks like dry needling, but we do so much more. And our acupuncture is so much more than a single trigger point that we need to start putting that out. So the things we're talking about now, including this, are aimed at what we can do to help our profession. The
Exactly,
PTs
Ellen.
have done a great job doing case studies of dry needling. We're going to
Yes.
model them, and that's okay. Sorry. All right.
Squeaky wheel gets greased first. We need to really speak about what we do. And somebody in the chat mentioned that 6-part article in Acupuncture Today talking about whole person health. One of the things which I actually, in teaching the continuing education classes on proper practice standards, was investigating a lot, that many of the practitioners cannot describe in the language of modern medicine whole person health and what it means. It's whole bunch of CPT codes. Even if you're not billing insurance, we still describing what we did in current procedural terminology. So that's one of the things. Also, how Ellen mentioned, there is a lot of case studies popping about dry needling. There is a lot of studies about acupuncture. Acupuncture is now one of the most productive in research professions. Unfortunately, most of that is published by MDs. So it speaks about acupuncture modality, but it does not speak about acupuncture procedure, which includes many modalities, and it does not benefit acupuncturists. It just creates interest among other professions for acupuncture modality. So we need to produce case studies, published case studies, which describe whole person health, all tools which we have in our toolbox. So we have a very recent initiative which is led by Colorado Chinese Medicine University in conjunction with RAND Center, which offers grants. And Colorado Chinese Medicine University with RAND in conjunction is creating a free 23 weeks long asynchronous course how to correctly write case studies, for they could be published in the most reputable journals for free. This is a very important remark because we are solo practitioners who don't make a lot of money. And let me tell you how much it costs to publish, like let's say in medical acupuncture, it's over $3,500 for the free access. Because I'm not going to pay to read the journal, I just don't have money. And I don't have to pay, and I will not pay to publish it because I don't have money. So in this case, please email Joseph Brady at du.edu, register for the free case studies writing class. You can take those classes at your convenience for free. Please follow the guidelines. Please write case studies pointing to the pattern, pointing to the series, pointing to the outcomes, which we absolutely need to publish. The best ones will be published in reputable journals. Those who will not pass through the criteria of best journals, we at the FASOMA will publish at our FASOMA journal digital edition gladly. So please take an opportunity. Thank you.
Thank you, Galina.
Any,
Thanks, Galina.
yeah, thank you. Any questions about case studies or the MD campaign? Okay. And I did see a thing about Chat GPT, and we've gotten ideas from there. But it still would help to have somebody with a marketing brain and language to help. So, okay. And now we have Cynthia Ann talking about some advocacy. Cynthia Ann, you're muted.
Can you guys hear me now?
Yes.
Okay, perfect. Thank you guys for coming tonight. I appreciate it. I'm the advocacy chair for FSOMA, and we just have done our IQ Ed Day in Tallahassee. We would love to have everybody participate with us next year. We presented a whole person centered health program to highlight all the wonderful things that we have in our toolboxes. We are also working on a speakers bureau. We'd love to have you guys participate. If you love talking to people about what it is that we do and you would like to go and participate in that, please contact me. The other thing that we have going on too is our monthly, you can change the slide to the next one, Ellen. The other opportunity we have is actually we're doing a monthly calendar of health events and health awareness. So we're doing articles and CEUs that we're trying to partner for the public and also for providers, so that if you wanted to work on journalism or writing a small article that would be easy for people to understand, to share with the public, we could share that among practitioners. Some people feel very confident doing that. Other people are hesitant to do that. And we publish these, we're trying to publish these once a month and have them go with the health calendar for the year. So this month is nutrition month, next month is stress awareness, and we have a whole calendar for that. If you'd like to participate in that, again, let Ellen or let me know. That would be wonderful. I appreciate your time. Thank you.
Yeah, these are past slides, and I'm actually going to just break in a second and let me see if I can share the website for a minute, because they are available on your on the website. So let me see if I can find them quickly. Nope, you're seeing the back end of the website. I didn't plan this. Let me just go back to the, if you go to your member dashboard, you'll see on there a social media images. We also send them out in an email every month when we get them ready. And those are things you can grab and share with your patients, with your community, and we all then are putting out the same message to the public each month. It's kind of like a campaign where the politicians all say the same soundbite for the thing. So for the month that we have men's health, we'd have this prostate symptom slide, and you could post it on your website with links to the study, and everybody would post it, and it'd be out there on social media widely. So this is something we've done, but not publicized as well as we could have. And we also have a public-facing page that if you have an article for patients, we can publish that as a post on the public-facing page and attribute it to you. So, if you've got articles you've written for your patients, send them in. We'll get them out there. So, okay. I think, Rebecca, you're going to start with this one. I didn't put your face on it, but this is something, yeah.
Yeah. And again, everybody, thanks for joining us tonight. While we have some kind of heavy and disappointing news with the potential occupational therapists, and, we're kind of, if you're like me, it's like, oh my gosh, who next, right? But what can we do? How do we turn this into positive? How do we stay positive? How do we stay proactive? One of the things that FSOMA is working on right now to put into place is a new practitioner support. So for new practitioners, maybe licensed within 1 or 2 years, we're going to create some small groups with volunteers that are perhaps more seasoned, like David, myself, Cynthia Ann, Galina. We have a lot of colleagues who've been doing this for well over 2 decades. And there's just a lot of wisdom to garner there. And we'd like to just connect everybody. I think since COVID, I mean, Zoom is great, but there's some things that are missing, and a lot of that connection and community is definitely one of those things. And we'd like to hear from you. If you have any other thoughts or ideas or what you'd like to say, we are here for you. We're volunteering for you. We work for you. So please reach out with that. But that's one of the things we are working on implementing this year. Next slide, Ellen, please.
Oh, I'm going to run through some stats real quick.
Mhm.
I'm not going to read this stuff, but you can see there's a starting at 55% of chiropractors belong, 13% of licensed acupuncturists. So if you're a member, we thank you. If you're not a member, please join. If you know other acupuncturists that aren't members, just let them know. We are stronger together. And this is one of the, chiropractors are very powerful in the state. MDs are very powerful legislatively. They all have more licensees than we do. But if we got 50%, we would have 1,000. We'd start to be a little bigger association. The next one is the number of registered lobbyists. MDs 10, chiropractors 5 to 7. Massage, and we have 1. Massage is a much bigger organization because they have so many more licensees than we do. And then paid staff, 25 to 30 at the FMA, 9 to 11 at FCA. And this is FASOMA. So oops, the paid didn't work, but we have 1 paid lobbyist, we have 1 paid staff, and you have 12 volunteer board members. The funny thing is we're small, but we're actually widely regarded in the US among associations as being proactive, influential. We've done a lot for being as small as we are. And we focus on supporting the practitioners and the profession and increasing access for patient care. So, if you want to join a committee and find out some more about what's going on, we could use you on committees for legislative advocacy membership. Please consider adding your name to the pile and your voice to the association. Thank you.
Yeah,
Okay.
and thank you, everybody. And I'd just like to say and wrap this up. And again, thank you for your hour this evening. I think we all can agree that Chinese medicine has survived not because one person had all the answers, but because knowledge over time was transmitted through relationships from teacher to student, from practitioner to community, from healer to healer. It's always survived through connection. And even though we're small, we can become mighty. We really can. Here in Florida, FSOMA is part of that lineage and that responsibility. Professional community unification isn't optional. It's part of an ethical practice to, join forces and support your association. Okay. We have what our communities need. We have the medicine that they need. They just kind of don't know it. Some people have never tried acupuncture. They don't know what we do. And, if not us, who is going to educate them and who's going to bring it to them? The ability to practice acupuncture as licensed professionals in Florida, in this state and others, didn't happen by accident. Okay. It exists because of organized, sustained advocacy. FASOMA is not abstract. It's your colleagues. It's all of us. There's no hierarchy. We're collective here. Okay. And we want everybody to have a voice. We want everybody to be a part of it. We are FASOMA. It's the voice that's going to be likely in legislative rooms that you'll never step foot in. A lot of us don't go. David's running up there at the drop of a hat's notice from our lobbyist, Corinne, if there's something important going on. I personally know he'll cancel his schedule. He hops in his car and he goes if there's a meeting coming up that they feel that it's necessary or important for him to be at, and he does that. And I just want to say too, and drive home, that the reason we're known in Florida to have one of the best Chinese medicine practice acts in the nation is because of FSOMA. The other groups who unite, they do better in legislation. That is a hardship for us. You know, you saw the numbers, you saw the slides with the data and statistics. We're small, and you know, there's a lot of room to scale. And I think we can do that. And I'd like to see us, you know, at any time, we need to join together now. So again, as Ellen said, you know, to our members here, thank you for your continued support. You know, I know we were often getting, you know, disappointing news at some of these town halls. I know, I've been doing this 16 years too. And if you're not a member yet, I just would encourage you to please consider joining. To all, as you can see, we need more volunteers. We need a blood and chi infusion in our organization. And how does that happen? That happens by, hey, if you feel you have an hour a month of a meeting. Our meetings are usually at this time during a weeknight, 1 hour. We try not to go over whatever committee. There's numerous committees. And then with that comes usually maybe 1 to 3 extra hours in a month of added work. And that might be making phone calls. Hey, if you're one of those who doesn't like to make phone calls, no problem. There's research work to do. There's a lot of projects to work on, and we could use more chi and blood, more people here. So if you have any ideas, anything you'd like to see, if you are curious about volunteering and want to know what's involved, reach out to me, reach out to Ellen. Notify us. We're happy to speak with you. We're here for you. We're here to help. We're here to assist. And, you know, we are stronger together, and we can be louder if we really unite. We need to get our numbers up. So, and I kind of said this in Tallahassee, and I'll repeat this again. You know, we all, like, I'm connected with different people than Cynthia Anna's connected over on the other coast, then David's connected up in his area. We have different connections. And for those of us who are members, let's talk to our colleagues who maybe aren't members, and let's ask them and say, hey, have you, you know, thought about joining, or would you consider joining? I make a lot of phone calls to colleagues here on this part of Florida. And I'll ask them, oh, can I ask why you're not a member? And a lot of them, it's really, they just out of sight, out of mind. They think of it, and then you know, life gets in the way. We get busy. So let's see what we can do about growing this. And thank you again, everybody.
Thanks, Rebecca. Yeah, I would just like to say, you know, sometimes, you know, we come together for town hall because sometimes who knows what news needs to be shared, but we had a couple of different types of updates. And I just remind everybody that our legislation, you know, it's going to keep moving. We have a sponsor. We'll have a bill next year, and we'll be making the same arguments as to why our language and our concepts that we need to improve on our statute need to be done. So, you know, we always have passing the hat, you know, recognize that we have lots of ways to support legislative and advocacy action here at the association. So, you know, make contributions and donations to that is always meaningful and well used and sincerely appreciated. And so we'll be asking at the conference, but for anybody who doesn't attend the conference, you might not have an opportunity. Ellen has some QR codes and other links that we use for making contributions to the various funds that we use to keep the profession moving forward. So I encourage everybody, even a few dollars, might be you know, $5 or $10 a month, or a one-time larger contribution, whatever makes the most sense for you. But certainly getting lots of small contributions is one of the main ways to success. So it's not painful for any one person, but you know, we're going to be forced to spend something in the $20,000 to $25,000 range again between you know, August 1st and let's say December 1st. And so money, comes directly from the membership to support very specific targeted legislative action to work on the things that I laid out for you. Without AIT, I think everybody would agree our Practice Act would suffer. Without a definition for the practice of acupuncture, it would suffer. Without access to evaluation and management, we're leaving tens of thousands of dollars a year in billables, on the table. There's things that we need to do to right our own ship, and it just takes a little bit of investment from everybody. And if you don't have the time, then put up the money. If you have some money, we'll take your time too. Thanks very much, everybody. I hope you have a good night.
And let me add 5 more cents. Fasoma is here not only to defend us, but also help us to succeed. And success is in numbers. If we have numbers, we have money, then we have money. We can negotiate insurance rates, for they would be paying us as we deserve to do so. If we have numbers, we actually can do a crowdsourcing and pay for advertisement to bring a patient to our doors, which brings money back to your pocket in much higher numbers. So please grab that colleague of yours who is not a member of the Fasoma and say, hello, I need your help, for we together would make more money. We hope to see all of you as members of the Fasoma. And thank you guys for being with us.
Thank you.
Yeah, thank you.
Okay.
Thanks, everybody, for coming. Thanks, Ellen. Thanks for everybody's support.
Yep.
Rebecca, thanks for a great town hall. Have a good night, all.
Right.
Thank you, guys.
If you need help finding anything, let me know on the website. Okay.